Good morning and welcome to the next in our series of virtual town halls. My name is Lisa Holmes. I'm the manager for the Community Network of Specialized Care, responsible for communications here at Anguinata. Today we're going to respond to a few of the questions that we've received with regards to COVID-19 and Anguinata's response. I'm joined this morning by members of our senior leadership team. To my left, we have Jeanette Denford, Chief Financial and Administrative Officer, Alistair Lamb, Chief Executive Officer, and to my right, Karen Menzies, Chief Clinical and Planning Officer, and Christine Park, Chief Residential and Community Services Officer. So we're going to start with some of the questions that we received from staff. The first being question one, the Kingston community has come a long way since the beginning of the pandemic. However, the lives of many people we support continue to be significantly restricted. This is affecting everyone differently, but many persons served across the organization have lost important routines, meaningful social connections, and are no longer able to participate in the activities that used to bring them joy, purpose, and fulfillment. Given that it could be a long time before typical vocational and recreational opportunities resume, such as day program work, volunteering, sports clubs, etc., how are we as an organization going to ensure that persons served will receive adequate, engaging, individualized opportunities for daily participation moving forward? That question was submitted by Chantal Carnegie from our Occupational Therapy Department. I'm going to ask Karen Menzies and Christine Park to address that.
Okay, so thanks, Lisa, and thank you, Chantal, for submitting that question. So I'm going to start off by making some general comments about the pandemic itself and some of the actions that the organization has taken. So the pandemic has had a major impact on all of us. We're all human beings and we're creatures of habit. So when our routines have changed, it has a major impact in terms of our overall well-being. For the people that we support, as we all know, routine is critical. And this pandemic has created a significant amount of loss in terms of day activities, involvement in the community, loss of contact with family and friends. And really, most of our people have been confined to their home for many, many weeks. In terms of the actions that the organization took at the beginning of the pandemic, they were extreme. We had to be decisive and we had to act quickly in order to ensure the safety of the people that we support as well as our staff. Now, the upside to those extreme measures is that to date, we have not had any positive COVID cases in either our clients or our staff, which is a real accomplishment and something that we can be proud of. So in terms of your question, Chantal, in terms of how do we ensure that individuals on a daily basis are actively involved and that they can participate in opportunities or around their well-being, I think one of the essential tools is the use of technology and the use of a virtual platform. And I'm going to make reference to the virtual wellness activities group that OT, clinical staff, spiritual care, and social work have been participating in. The feedback thus far for those people who have participated is that it's been a positive experience. It's been an opportunity to see friends. And when asked, for example, at the end of a session with social work and a host family, participants are saying, "I want to meet again." I also want to acknowledge the work and the effort that frontline staff have made in order to make this successful. This is key, and I think this is an opportunity for us to continue to build on the virtual technology. Now, what people also need to know is, as an organization, we're watching very closely in terms of what's happening across the province in terms of reopening, and we're in constant conversation with public health around what that needs to look like. And I'm going to turn things over to Chris in just a moment so that she can speak to some of the activities around day support. But what people have to understand in terms of reopening is that there is considerable rigor around reopening and that we have to do it safely. So without a vaccine, the reality is that in future, if we are reopening activities, it will be very small groups. And so the reality is the tool in terms of a virtual platform and building on what we're currently doing is critical to provide the daily opportunities for people. And frontline staff involvement is critical in terms of making it successful. And I believe that feedback and dialogue is very important. So what I would do is I would encourage frontline staff to advise. Rhonda Dillon and Maureen Hewson, Liz Brewer are all involved in terms of the virtual activities. And what I would encourage people to do is to highlight what's working, what's not working, and then have dialogue to further enhance the use of the virtual platform. And I'm now going to turn things over to Chris, and Chris is going to talk a little bit about day programming.
Thanks, Karen. So just to clarify first that the day program piece that's opening in relation to Chantel's excellent question is actually targeting a different group that is sometimes overlooked a little bit in the process right now, and that's the families that are in the community. So we know there's been tremendous impact for families, period, and the families in Anguinata are not just the families in residential, but it's all of those communities families that we have. Many of them have access supports at Crescent and Past and at Respite and all sorts of other things. And though we've been fantastic, and kudos to the staff for doing such a good job of keeping the people we support well and healthy, the families have taken on that burden themselves, and we need to kind of reach out and help them, because this has turned out to be quite a long process. So the Crescent is opening, and I'm really excited about that. It's opening on Monday, and people have been at Crescent all week getting it ready with lots of preparation, and frankly, in weeks even prior to this week, helping set the stage and working really closely with public health to make it happen. And that process was not without its challenges in terms of negotiations. We thought we could open it, we couldn't, we kept trying. And our emphasis for doing that was really to be mindful that there are other families that we need to ensure that we remember them in the process, and the broad notion of families in Anguinata. So when Crescent opens on Monday, it will be welcoming back some of the people from the community. The rules for us are around what is a cohort, how many people can we have there at a time. Public health would suggest that the cohort, or the notion of a group, is around 10 people. To be extra careful, we're probably going a little bit lower than that. So our target is around 5 people in a classroom. The goal is to get our numbers higher so that we can support more people, and eventually people from residential as well. But at present, again, the focus is on our community families. The staff, again, have done an absolutely fantastic job. I'm really confident that this is going to go quite well, and that hopefully as things continue to open up in the province, we'll continue to expand that. Respite is probably a question that's going to come up in a little bit more detail kind of going forward, but respite obviously is also a priority for us, and that those families have also been quite hit by what's going on with the pandemic, and many of them have been without any supports at all. So we're really mindful right now to make sure that we include them going forward in the things that we're trying to do.
Okay, great. Thanks, Chris. Sort of a follow-up question from the residential area. There have been a number of new residential job postings recently, and is this related to COVID?
Yeah, you know, Lisa, it's a really good question, because it is related to COVID in terms of in ways that we may not have anticipated, and that are really important that we consider. So for me, a big one in that is actually what we're doing with Wilson. So Wilson has been, has slipped into the role, and a really helpful one, of actually being an isolation or quarantine unit for our people who've been going to the hospital. And as things around that have shifted, we're setting up more isolation or quarantine options in the homes and looking at models where we're going to be incorporating some basement conversions and things like that. But again, mindful that the purpose of Wilson, and Wilson is actually a children's license site, and it's the only one that Ongwenada has. And those families, again, have really, really struggled. So we're going to revisit that and make sure that we get Wilson up and running again. But in doing that, also looked at how have the profile of the individuals that go to Wilson changed. And they've changed quite substantially, to tell you the truth, right? So historically, they were very different, particularly kids that we were supporting, perhaps than the children we're supporting now. There's a really big increase in the number of kids with ASD, as an example. And certainly behavioral challenges are far more prominent in terms of the profiles of the kids, which again makes us mindful that those families, they have very challenging kids, and to not get respite is really hard on everyone. So it's just imperative that we get Wilson kind of back on track in terms of providing the service to this community that is so valued and needed. So in doing that, we've actually changed the profile and the staffing. So that's to move towards RC2s, recognizing the complexity of the kids that we're supporting, and the adults, because we also provide adult respite there. At different times, and also the need for continuity, because around ASD, continuity is key for success. So moving to a model with full-time staff. So that's what one of the postings about. The second posting is about Henrietta. Henrietta being one of the houses that we have in Gananoque. So that's actually evolved as well, a little bit out of the notion of looking toward their families in the community and how much they're struggling. So that house is needed by this community to provide another service. And the service that's kind of coming to our attention first and foremost is a term that many of us know called transitional age youth. So for those of us who have kids that have grown up, we know that teens are tricky. Teens are tricky when they have some special needs sometimes as well. So, and again, teens with ASD in particular can go a particularly challenging time because of all the transitions around no school and perhaps some onset of some other complications around diagnosis at that age. So Henrietta is an absolutely wonderful house, really great location. So we're really excited to be able to rejig some of the things that we're doing, get Henrietta up and operating. We're hoping, based on the posting, not too far after Labor Day in September, and look specifically at youth. We've got a really great relationship going on with the school board in GAN, and we want to build on that really positive relationship, really looking at compatibility for the age group, and that, again, looking at staff that have a willingness to work with people who are very complex and do present with some behavior challenges. So those are what the posting's about, and I'm really delighted we've got a good response to that. So thank you to all the staff who want to do that kind of work.
Great. Thank you, Christine. So our next question comes to us from Lori Burt, who's a behavior therapist. And Lori is wondering how long we'll be working remotely from home. Is there a 6-month, 12-month, 24-month plan? I'm going to ask Alistair to speak to that.
Thanks, Lisa, and thanks, Laurie, for the question. And it's a question that's been asked not only here at Ongwenada, but at employers throughout the country, if not the world. As was already mentioned, we take our lead when it comes to dealing with this COVID pandemic from public health locally and from the province. And at this point in time, there is nothing definitive, and I can't say anything specifically or definitively when staff will return to the office, and indeed what that return will look like. What we're anticipating, however, is that we may have some staff who will continue to work from home more or less on a permanent basis, perhaps popping into the office occasionally. And for those types of staff, we've actually created 4 bookable workstations in what used to be the auxiliary gift shop, and that kind of is referred to as hoteling. So somebody comes in, they pop their laptop down, they work from that space for that day, and then for the rest of the time they work from home. So that would be one potential. There would be some staff that would fall into that category. Another category of staff may be some who work from home for a couple of days a week and then come into the office for a couple of days a week. And in those circumstances, they may share the same office, they may share the same desk as somebody who works the opposite days of the week at home and comes into the office the opposite days of the week. And then, of course, there would be a third cohort, and that would be the folks who have to work from the office permanently because their job doesn't allow them to work remotely. All that to say is that we're still working that through, and I don't have a definitive timeline. Now, we do have activities underway, and that's largely been led by Karen Sly and Peter Gould, essentially doing an environmental audit of our buildings, and more specifically of ORC, to determine what modifications to our facilities will be required prior to staff returning. Some of the stuff that we're looking at is the ability for staff to continue to maintain social distancing or physical distancing, limiting the number of chairs in meeting rooms, use of bathrooms to a single occupant, directional signing in the corridors, and then of course housekeeping. So those are all elements that we're looking at as we prepare for the return to the workplace. There are also plans underway for various services at ORC that are either in development or have been completed. For example, for our research labs, they can't work from home, they can't do the research from their kitchen table, so they have to come in to do the lab work here. So they've got a plan to return, and in fact some of them have already returned. Plans underway for our medical associates reopening, our pool, our radiology, they are underway at the moment as well. So that's kind of where things are at. It's not an answer to your question, Laurie, as definitively as perhaps you and others would like, but hopefully you get a sense that we're actually working things through, and we'll keep you posted.
Thanks, Alistair. So our next questions relate to a hot topic for Jeanette. It's her favorite topic these days in regards to pandemic pay. So why did I not receive my lump sum payment? Jeanette?
Thanks, Lisa. So yes, it is a topic, quite a hot topic that I've been working with these past few weeks. And so before I get into the specificity in regards to individuals who may have not received their lump sum payment, I just wanted to explain what the lump sum payment in fact is. The ministry provided us some guidelines on the calculation of the 100-hour requirement for the $250 lump sum. It's based on hours worked in a congregate care setting. So this means vacation, sick leave, bereavement, compassionate, lieu time taken, either unpaid or paid, does not qualify. The lump sums are being dispersed in four-week time frames. And the time frames are, and I'm just going to reiterate them to you. The first time frame was from April 24th to May 21st. The second time frame was from May 22nd to June 18th. The third one has already started, and it's from June 19th to July 16th. And the fourth and final time frame is from July 17th to August 13th. Unfortunately, these time frames do not coincide with our pay cycles. So when we calculate the 250 lump sum, we have to look at the amount of hours during those time frames that I just outlined. So that's just some background in regards to how it's being calculated, and we would be remitting if you qualify for the 250 in the next pay once that closes from that time frame. So, unfortunately, I also do want to talk about a situation that just recently occurred, and that we missed paying out the lump sum for approximately 140 people. This was through no fault of Anguanada's, and we're working diligently with our payroll provider, MediPay, and it wasn't added to their July 3rd, even though they qualified. So that would have been the lump sum for the second time frame. Now, what we did though is we did create a special run. And the special run was created this past week, and it has been deposited into approximately 140 people's bank accounts as of this morning. So that has been done. I would like to thank all the staff and for being patient with payroll and with myself as we roll out the pandemic pay. It does, I know it is very difficult when people talk about, their personal pays and so on and so forth, but for the most part, people have been very understanding. We're working really hard with our payroll provider to make sure that the $4, which is a fixed rate, and the lump sums are being paid. Lastly, I wanted to mention that Anguanada is and was one of the first employers in this area to pay out the $4 and the lump sums. Unfortunately, a couple of people have been missed, and I would appreciate that you continue to address your questions at payroll@anguanada.com. Thank you.
Great. Thanks, Jeanette, for that explanation. Another question we've received from a number of people with regards to pandemic pay is why they were not included in the pandemic pay even though they worked throughout COVID. Alistair, would you like to address that?
Sure, I can address that one, Lisa. The pandemic pay is a provincial initiative, and the eligibility criteria for that pay were established by the Ministry of Children, Community and Social Services. And staff had to meet two criteria in order to qualify for pandemic pay. One criteria was that they had to work in an eligible work location, and the other criterion was that they had to hold an eligible job classification. And those actually were communicated to staff in a memo or a letter from me dated June the 9th, 2020, where it outlined the eligible work locations and the eligible job classifications. And they can also be accessed actually on the ministry website. I don't have the URL with me, but if you search Ontario COVID-19 pandemic pay, it will probably take you to the link to that website. So that outlines in detail who does and doesn't qualify, and that was the application of the criteria, as I say, as established by the province. So that's why some people did get it and some people didn't.
Okay, thank you, Alistair. So one final question, and I'm going to address this to Alistair. So what are some of the lessons learned from the pandemic, and will everything just go back to the way it was, or will some of these changes be permanent?
Thanks, Lisa. That's a really good question. Lots of lessons learned. And some of which we'll be able to address, some of which we're still in the process of learning. When the pandemic hit, Anguanada was required to respond swiftly, and Karen's kind of already alluded to that earlier. Decisions that would have taken months, if not years, to implement during any other time were made in literally a matter of days. And these decisions were made with the sole aim of keeping the individuals that we serve and the staff of the organisation safe. Fortunately, we were in a well positioned to react. We already had in place good infection control practices. We already had a pandemic plan or an emergency plan in place, which we enacted. We had excellent collaboration between senior leadership, management and our unions. And we had a dedicated staff who were diligent in following the infection control directives that came out through our incident command or came out through public health. We've now had the opportunity to take a closer look at the steps that we implemented, and of course, as already been discussed this morning, we're kind of planning for the new normal as we start to reopen. We can't say, as I've already referenced, with any certainty exactly what that will look like. But much like the rest of society, we already know that we will not be returning to the way things were 4 months ago. For example, one change that was recently announced was the closure of the kitchen and cafeteria services here at Ongwenada. And the reasons behind that decision were communicated in a memo that I sent out on Thursday, I believe it was, or Wednesday. As referenced previously, remote work or working from home is another thing that will likely remain in some form or fashion moving forward. And again, as I've already mentioned, or has already been mentioned, we're slowly beginning to reopen programs and services. But again, we're doing so with the utmost caution to ensure the safety and well-being of the individuals that we support, as well as the staff. And we're doing so with the understanding that we may have to close these programs again if we have another wave. And that's something that we have to be prepared to recognise. Kingston's been pretty fortunate regarding the impact of COVID-19, but the recent outbreak in nail salons is an indicator of how quickly things can turn around. That's why we all have to maintain our diligence and continue to follow the infection control guidelines and recommendations. The fact that we've managed to keep COVID-19 out of the organisation thus far is in no small measure due to the efforts of all of our staff. And I want to finish by thanking each and every one of you for the work and the commitment that you have demonstrated in providing supports and services to some of the region's most vulnerable people, and for upholding Ongwenada's values of support, respect and choices. Thank you.
Great. Thank you, Alistair. And just a reminder to all staff, if you have further questions at any time, you may submit them to our special COVID account, which is covid@ongwenada.com. Thank you.